So let's start. What's OpenNotes? Just to make sure everybody has the context here, OpenNotes is a national movement dedicated to making transparency more obvious by encouraging clinicians to make their visit notes easily accessible. We are philanthropy funded. We're not a business organization that's selling a software or product, and we don't have a business relationship with OCHIN. We have loved working with them as partners in this movement around promoting transparency. Next slide. This is a simple idea. Oftentimes this gets too complicated because, as you'll hear, there's a lot of anxiety around this transparency. You know, I know some folks out there think, well, notes are for doctors, they're not for patients, and that argument's been settled. Patients clearly have the right to read their notes. All we're talking about is making making notes easier to get to. And you know, for that reason, I mean, this really is a simple idea. We're talking about efficient and improvement in communication. Next slide. Now, we know we've worked with 200 implementers and probably have another 150 out there who are in the process. I'd say 95% of them, the key concern they have is their clinicians are anxious. They are really anxious. They think that patients are going to be unhappy with notes. There's going to be increasing calls, lots of changes to requests to change notes. In the aggregate, that doesn't happen. There really is no evidence of significant increases in anxiety or complaints or lawsuits. Workflow doesn't change with one exception, and that's around documentation, and we can talk more about that. There is no evidence of increase in messages, calls, or longer visits. Folks will worry about the doctor-patient relationship, but there's no evidence that anything but good things happen to the doctor-patient relationship. And as you'll see, that's especially true in the patient populations that the safety net clinics serve. Trust increases. Even when there's an error, even when there's a concern, patients really respect their clinicians when those errors are sorted out, when their confusion is straightened out. Next slide. There's a key, I think, for this discussion. When you ask patients, including vulnerable patients, how do you feel about your doctor after you've read a note? 37% say they feel better. 62% no change. You add those two numbers, 99% feel the same or better about their doctor when they read a note. And this is especially true for older non-Caucasian patients with poorer health, lower formal education. So this really benefits the populations we're talking about today. You see the other numbers there that also, I think, provide some reassurance about what happens. Next slide. In conclusion, there's lots going on. Medicine and technology is changing. There's new rules recently out from Health and Human Services and ONC about the 21st Century Cures Act. We think OpenNotes helps to improve care and patient-centeredness with the minimal disruptions. We know there's concerns about those. They're genuine. They have to be managed, but we think they're manageable because based on our experience, implementation always ends well. In the future, we'll probably need to talk about getting better at implementation because, as you'll hear, it can be a little bit of a struggle for patients to figure out portals and find their notes.